Let's get right into it. Number 15. The Tonsil Guillotine. Imagine a tiny guillotine designed specifically for your throat. That's not a metaphor. In the 1800s, doctors used a real tonsil guillotine, a small, scissor-like contraption with a circular blade that chopped off your tonsils in one satisfying motion. Picture a cigar cutter, but for human flesh. This lovely piece of hardware was considered a major innovation because before that, doctors just hacked at your tonsils with knives or wire loops. The guillotine made it cleaner. You'd sit in a chair, probably terrified, and the doctor would shove the tool into your mouth, line it up, and schlick. Congratulations, you're now bleeding profusely and wondering why everything tastes like iron. No anesthesia, of course. That would have been cheating. The idea was that if it was fast enough, maybe you wouldn't scream for too long. It was a race between pain and precision, and pain almost always won. The weirdest part? This thing was used well into the 20th century. It was so common that people bought home tonsil guillotines, because apparently 1920s parents thought self-surgery was a family bonding activity. So the next time you complain about waiting too long at the dentist, just remember, at least they're not coming at you with a throat guillotine. Number 14. The Artificial Leech. Leeches were the all-purpose medical tool of the 1800s. Feeling sick? Slap some worms on your neck. Headache? Worms. Coughing blood? More worms. But when real leeches ran short because doctors used millions of them, they invented something worse, the artificial leech. This was a small metal device with blades that punctured your skin and created suction to draw blood. Because humans apparently looked at nature's grossest animal and thought, asterisk, let's make a mechanical version, asterisk. You'd clamp it on the skin, twist a dial, and little razors would slice into your flesh while a vacuum chamber sucked your blood out. It was reusable, efficient, and perfect for doctors who didn't want to chase slippery worms around a table. The logic behind it was simple and horrifying. Back then, medicine believed that illness came from bad blood. So draining you like an expired juice box was considered therapeutic. People would literally faint mid-treatment while the doctor cheerfully said, "Looks like it's working." Today, leeches are still used medically, but only the real ones, for precise microcirculation in surgeries. No one's cranking a brass bloodsucker anymore. Progress, people. Number 13. The Trephination Drill. Picture this, you've got a headache that just won't quit. Instead of taking aspirin, a Bronze Age doctor decides to drill a hole in your skull. Congratulations, you've just been trephinated. Trephination is one of humanity's oldest surgical procedures, dating back thousands of years. The idea was that evil spirits caused illness, so drilling a hole would let them out. What's more horrifying is that people survived this. Archaeologists have found skulls with smooth bone regrowth, meaning the patients didn't die immediately. They just walked around with ventilation holes in their heads like prehistoric air conditioners. By the 1800s, it evolved into the trephine, a neat little circular saw with a handle, basically a crank-operated apple corer for your skull. It was used to relieve pressure after head trauma or, just balance your humors. Doctors would manually twist the blade into your bone while you sat there, sometimes awake. No anesthetic, no antibiotics, just breathe through the pain and don't move your brain too much. If you're wondering what that sounded like, imagine the sound of wood being drilled, but it's your skull. Yeah. Sleep tight. Number 12. The Vaginal Speculum, Old Edition. If you've ever seen a modern speculum, you know it's not exactly a comforting sight. Now imagine one made of cold, rough metal in the 1840s, designed by a man who probably didn't ask a single woman how it felt. That's the old-school vaginal speculum. Dr. James Marion Sims, often called the father of modern gynecology, developed it to study women's reproductive systems. What he didn't mention was that he tested it on enslaved women without anesthesia, because back then, doctors literally believed black women couldn't feel pain the same way white women did. The speculum itself looked like a medieval torture device. Hinged, screw-tightened, and terrifyingly reflective. It was described as innovative. But if you saw it today, you'd assume it belonged in a dungeon next to rusty shackles. Modern speculums are still pretty uncomfortable, but at least they're sterile, temperature-safe, and used by trained professionals, not curious men with zero empathy. The old version? It's a brutal reminder that medicine's progress often came with pain, ignorance, and some truly questionable ethics. Basically, the speculum is proof that science sometimes advances by scaring people half to death. Number 11. The dental key. You know that little twisty thing you use to open a wine bottle? Now imagine using it to yank a tooth out of your skull. That's the dental key, also known as the tooth key. Because apparently, dentistry in the 1700s was equal parts carpentry and torture. Here's how it worked. The doctor or barber, because those were sometimes the same person, would clamp the curved metal claw around your tooth. Then, like uncorking a bottle of Merlot, they'd twist. The idea was that the tooth would neatly pop out, but most of the time it just shattered into sharp fragments while your gums ripped like overcooked meat. If the patient was lucky, they'd only lose one tooth. If not, the key could break their jaw. Dentists eventually realized that twisting wasn't the most ergonomic motion for human faces, and replaced it with forceps, a massive upgrade, considering the bar was less likely to dislocate your jaw. The best part? Dentists back then didn't even wear gloves. They'd just dig around in your mouth barehanded, probably after lunch. So if you ever think your dentist is scary now, remember, at least they don't come at you with a key and a prayer. Number 10. The chainsaw, yes. Really? Before you panic, no, this isn't about lumberjacks. The original chainsaw was invented in the 1780s for childbirth. Back before C-sections were common or remotely safe, doctors had to enlarge the birth canal if the baby got stuck. Instead of a surgical incision, they'd cut through bone and cartilage. And because sawing by hand was slow and messy, someone thought, hey, what if we made it automatic? Thus, the hand-crank chainsaw was born, a small, rotating blade that could cut through pelvic bone faster. It was horrifyingly efficient, and doctors actually praised it for saving time. Never mind that the mother was fully conscious, there was no anesthesia, and sterilization was a fantasy. Eventually, people realized this tool was too brutal even for medical use, and it was repurposed for woodcutting. So yes, the thing that horror movies used to chase people through forests started as a gynecological instrument. Somewhere, someone decided to market it for trees instead of humans, and we should all be thankful for that pivot. Number 9. The Bloodletting Fleam. If you ever wanted a Swiss Army knife specifically designed for stabbing veins, meet the Bloodletting Fleam. Used from the 1600s to the 1800s, it was a foldable brass case full of tiny blades that doctors used to slice open your skin to release bad blood. You'd get a nice, neat incision, usually on your arm, sometimes on your neck, and your blood would pour out into a bowl while your doctor nodded approvingly like a sommelier. Ah yes, this patient has an excellent 1794 vintage. The belief was that nearly every illness came from too much blood, so doctors bled people for everything from fevers to anxiety. You could literally walk in with the flu and walk out lighter by half a liter. Some barbers even offered bloodletting as a side service, which is why the classic barber pole has red and white stripes. The red stands for blood, and the white for bandages. Cute, right? If that doesn't make you rethink every barbershop you've ever passed, I don't know what will. Number 8. The Hemorrhoid Snare. Let's talk about butts, because history sure did. The hemorrhoid snare was a tool for, well, exactly what it sounds like, cutting off swollen veins in your rectum. Because apparently, there's no body part 19th century medicine didn't want to stab or twist. It looked like a long metal wand with a looped wire at the end. The doctor would insert the wire, lasso the hemorrhoid, and tighten it until the blood supply was cut off. After a few days, the dead tissue would just fall off. No anesthesia, obviously. Maybe a little brandy for comfort, which did nothing except make you slightly drunk while your backside was being tortured. And while the snare technically worked, infections were common. People would often end up worse than before, but hey, at least the hemorrhoid was gone. That's efficiency by 1800 standards. Modern medicine replaced it with far less medieval methods. But if you've ever thought colonoscopies were awkward, just be glad no one's swinging a metal lasso down there anymore. Number 7. The Smoking Enema. Yes, this one's exactly what it sounds like. And no, you can't unlearn it. In the late 1700s, doctors actually used tobacco smoke enemas as a legitimate medical treatment. They literally blew smoke up people's butts. It wasn't slang. It was science. The belief was that tobacco smoke could stimulate the body's vital energies, especially for drowning victims. Lifeguards along the River Thames in London were actually equipped with smoke enema kits, brass tubes, bellows, and a hose that went, well, you know where. The rescuer would blow tobacco smoke into the rectum, thinking it would restart breathing by warming the body from the inside out. Imagine waking up after nearly drowning and realizing your first breath of life came courtesy of someone's butt smoke revival system. Romantic. Eventually, doctors realized that inhaling or injecting nicotine directly into the bloodstream wasn't the healthiest choice. Shocking. I know. The practice faded away by the mid-1800s, and the phrase, blowing smoke up your ass, became a sarcastic way of saying, you're full of it. So yes, that insult has disturbingly literal origins. History. The gift that keeps on giving. Number 6. The rib spreader. If you've ever had a chest surgery, you might already be familiar with the modern descendant of this beast. But the rib spreader, especially the early versions, was like something out of a torture museum. Invented in the early 1900s, it was designed to pry open your ribs during surgery so doctors could access your heart or lungs. Think of 2 metal arms inserted between your ribs, with a crank that forces them apart inch by inch. The sound alone could haunt a person. Early surgeries often took place before general anesthesia was refined. So imagine being barely sedated while your ribcage creaks open like a rusty gate. Doctors described the sensation as pressure. Patients described it as a waking nightmare. The most famous model, the Finocchietto rib spreader, was considered revolutionary, and in a way it allowed surgeons to perform life-saving operations that were previously impossible. But it also cemented its place as one of the most viscerally horrifying tools ever invented. It's still used today, albeit in far more humane conditions. But next time you hear something crack at the doctor's office, maybe don't ask what instrument made the sound. Number 5. The Ice Pick Lobotomy. Ah yes, mental health treatment, 1940s edition. When in doubt, stab the brain. Dr. Walter Freeman pioneered the Ice Pick Lobotomy, a procedure designed to cure depression, anxiety, and basically any human emotion doctors didn't understand. He'd take a long, thin metal pick, slide it under your eyelid, hammer it through the thin bone behind your eye socket, and swirl it around to sever the prefrontal cortex. Took about 10 minutes. No surgery room, no anesthesia, just a mallet, a pick, and an overly confident man with a god complex. Freeman even toured the U.S. performing lobotomy roadshows, sometimes doing dozens in a single day. The aftermath was unpredictable. Some patients became docile and emotionless. Others suffered seizures, memory loss, or permanent disability. Freeman called them success stories because they weren't screaming anymore. This went on for years before people realized that mutilating the brain probably wasn't the best therapy method. Shockingly, mental illness can't be fixed by a glorified ice pick. It's one of those moments in medical history that makes you stare at the wall and think, we really let that happen, huh? Number 4. The plague doctor's outfit. You've seen it, the long black coat, the wide-brimmed hat, and that horrifying bird mask that looks like a cosplay of death itself. But the plague doctor's outfit was actually meant to protect physicians during the bubonic plague in the 1600s. The mask's beak was stuffed with herbs, spices, and flowers, basically medieval potpourri, because they thought bad smells caused disease. The goggles protected the eyes from miasma, or poisoned air. The coat was waxed leather, meant to stop fleas, which, ironically, actually were spreading the plague. The result was both brilliant and nightmare fuel. Imagine you're dying of fever, you wake up delirious, and the first thing you see is a silent, bird-faced figure looming over you with tongs. Yeah, that probably didn't help your recovery rate. The doctors would poke and prod you with a long cane, not to be rude, but to avoid touching you directly. So, basically, they were the original social distancers. It was creepy, bizarre, and weirdly practical. And while it didn't save many lives, it did give us one of the most iconic and unsettling images in medical history, the human embodiment of bad vibes only. Number 3. The Civil War Bone Saw. If you think hospital dramas today are intense, try picturing surgery during the 1860s. No anesthesia, no clean instruments, no antibiotics. Just a tent full of screaming soldiers and a doctor with a bone saw. During the American Civil War, amputation was basically the go-to treatment for anything involving a limb. Bullet wound? Amputate. Infection? Amputate. Stub toe? Well, not quite, but close. The idea was that cutting off the infected part quickly could save the rest of the body. And quickly was the key word. Surgeons were expected to finish an amputation in under 3 minutes. The saw itself looked like something you'd find in a toolbox. A long metal blade with a bone handle, sometimes curved for better grip. The surgeon would slice through flesh with a knife, then grab the saw and cut through the bone while 2 assistants held the patient down. All while the poor guy was awake or, at best, slightly drunk on whiskey. The floor would be covered in sawdust to soak up the blood. A charming detail that really completes the mental image. Despite how horrifying it sounds, these doctors were doing the best they could with what they had. Many amputees actually survived thanks to their brutal efficiency. Still, there's no way to describe that sound, that scraping, sawing sound, without your stomach twisting. Let's just say, if you ever time travel to the 1860s and hear metal grinding against bone, run. Number 2. The urethral sound. There are few phrases that can make a person flinch instantly. Urethral sound is one of them. Used since the 1800s, this instrument was designed to treat blockages in the urethra, the narrow tube that carries urine out of the body. Sounds, which ironically don't make any sound, were long, slender metal rods, sometimes curved, sometimes straight. Doctors would insert them into the urethra to stretch the passage. If you're wincing right now, congratulations, you're human. Back then, this was considered a routine treatment for conditions like strictures or infections. In practice, it was agony. Without anesthetic, patients would grip the table while the doctor gently, or not so gently, worked the rod in deeper. Some versions even had graduated sizes, so the process could be repeated with larger instruments. Because apparently once wasn't enough. The procedure could cause bleeding, infection, and, in some cases, lifelong trauma, physical and psychological. Modern medicine still uses a version of this technique, but it's done with sterile tools, pain control, and actual medical reasoning. Still, the historical version is the reason every guy's soul just left his body for a second. Number 1. The Resuscitation Bellows. Before CPR and defibrillators, doctors used something far more unsettling to bring people back to life. Resuscitation Bellows. If you've ever seen the tool used to stoke a fireplace, that accordion-like pump that blows air, it's basically that, but for your lungs. In the 18th and 19th centuries, doctors would insert a metal or ivory tube down your throat, or sometimes through your nose, and pump air directly into your lungs with a hand-operated bellows. In theory, it was supposed to restart breathing. In reality, it often burst lungs or filled stomachs with air. But hey, at least they were trying. Some designs even included attachments for blowing tobacco smoke, yes, again, because doctors couldn't resist combining every bad idea into one multi-tool of horror. And since they had no understanding of lung pressure, it wasn't uncommon for patients to inflate like a sad human balloon before, well, you can imagine how that ended. It's gruesome, it's absurd, and it's the perfect symbol of early medicine. Creative, determined, and wildly dangerous. That's all for today. I'll be making similar videos in the future. Subscribe to see them.